Well, good afternoon, and thank you for joining us for today's town hall, everyone. I'm Suzanne Legui, Vice President of Strategy, Communications, and Stakeholder Relations at RVH, and I'll be your host for today. Again, thanks for joining us. With the easing of COVID restrictions in the community and the sort of warmer summer weather that's upon us, we have many people believing the pandemic is behind us. However, infectious disease specialists say Ontario has sadly entered a summer wave as hospitalizations and wastewater data slowly creep upwards. At the same time, RVH has experienced higher patient volumes, increased patient acuity, and like many hospitals in Ontario, we continue to struggle with a shortage of health human resources. All of those factors combined are pointing towards another very busy summer for Team RVH. In fact, 2022 is shaping up to be a very busy year for RVH, a year in which we celebrate our 125th anniversary of providing exceptional patient care to Simcoe Muskoka. And this week, we also celebrate an important milestone as we welcome RVH's new president and CEO, Gail Hunt. So with just one full day under her belt, we're excited to have an opportunity to get to know Gail through this town hall. So to more fully introduce her, I'm pleased to also welcome RVH's new board chair, Doug Frost. Now, Doug is no stranger to RVH, having joined the board of directors in June of 2013, and he most recently held the position of first vice chair, and he's been actively involved in the search for our new CEO as well over the past several months. So Doug, I'll turn it over to you to introduce us to Gail.
Okay, good afternoon, everyone, and thank you very much, Suzanne. I'm honored to be with Team RVH today to introduce you to our new CEO and president, Gail Hunt. The board of directors of the hospital has probably three key jobs. One is strategic planning for the future, governance and operations, or governance and oversight of operations, and most importantly, we've got to ensure that RVH has strong leadership in place. And Gail was unanimously selected after a fairly extensive 4-month process that involved our selection committee, assisted by a third-party consulting group. She's an experienced, high-performing healthcare leader, a team builder with over 20 years experience in the healthcare industry. And we're also really pleased that she's a local candidate and knows our region. She's got extensive experience working closely in past with RVH in her previous role as president and CEO of GBGH in Midland. She's very familiar with the healthcare needs and challenges of Simcoe Muskoka. Gail holds a master's in business administration degree and a Bachelor of Commerce degree from Laurentian University. And prior to her role at GBGH, she spent 16 years as CEO of Chapleau Health Services in Northern Ontario, a provider which has to manage all aspects of healthcare delivery, including primary, acute, and long-term care. Most importantly, Gail is a collaborative leader who's approachable and passionate about building strong teams and providing safe, quality care to our patients. So as you can see, Gail was the clear choice for RVH. So Gail, welcome. And maybe let me ask the first question. Why was RVH the clear choice for you?
Well, that's a very direct question. Thank you, Doug. Having lived in the community for the past 5 years in the Simcoe County, there is no healthcare without this regional center, and the opportunity to be a part of that regional center was, too much to pass up on. As the surrounding hospitals to RVH, we've had integral partnerships with the hospital, shared staff, shared medical leaders, all in an effort to work collaboratively together to get, to provide that best care to the patients. So the opportunity to be a part of that and the trajectory that RVH is on in the future to really double in size to meet the demographic demands of this population and expand services to bring more local services here. I just couldn't pass up on that. So it was definitely the clear choice for me. And I'm pretty excited about it.
Thank you, Gail, and thanks, Doug. We look forward to continuing to work with you, Doug, in your new role as board chair. And we're joined today by a panel of Team RVH members who will be asking Gail some burning questions. And first up is Dr. Raj Grover, RVH radiologist and president of the Professional Staff Association. And Raj was also a member of the search committee as well. So Raj, what do you want to ask Gail?
Thanks, Suzanne. Gail, I'm sure this is a question on all of our minds. Can you describe your leadership style to our team?
Sure, thank you. I think it's hard to describe your own leadership style because you don't experience it, everybody else does, but I believe that I'm a very authentic leader. What you see is what you get. Very collaborative. I like to hear from all opposing sides on an issue to be able to get to the best decision. I'm very candid. I want to hear what you candidly think, and I will tell you what I think. And I've been telling the groups that I really like to debate to get to the best decision. So we shouldn't all agree because Gail says or somebody says on the leadership team. We should get to a decision because we had a really candid, thorough discussion about it. And if there was opposing, disagreeing views, that we shared those and we got to the best decision. So I would say that that's sort of my leadership style, as well as I believe that, you know, we don't have to grind staff down to get to these, you know, objectives we want to get to the future, that we can get that in a way that at a pace that staff can recover from COVID, not be exhausted, and can achieve all the exceptional goals that we have in mind, but at the same time, come to work having fun and excited to be here and feeling supported and valued at the organization. So I would say that's sort of my leadership style. Hopefully that answers your question.
It does. On a more serious note, what do you see as your superpower?
I would say my superpower is decisiveness. I am very good at making decisions. It's one of my stronger points. I think that you will hear me say that perfect is the enemy of good. I think sometimes we get caught in a little bit of paralysis by always searching for more information. We will never get to a perfect decision. So when we have enough information to make safe, logical decisions, then we should do so. And I also believe in trusting in our people, the ones who know the best, the ones who are experts, to make those kind of decisions. So what can we do to support them and give them the authority and accountability to make those decisions? So I would say decisiveness.
And where do you struggle?
I think I struggle most in not knowing something. It's always my biggest fear that, you know, we have values and how we want the patient's experience to be here, and how we want staff and medical staff experience to be, and the thought that that might not be occurring somewhere in the organization. Somebody may be having a negative experience or not what we envisioned, and we don't know about it. I think that's always my greatest fear, is that, you know, somebody not relaying that information up to us, or, you know, us saying as leadership, telling people what our values are, but that's not what's being lived in the organization. So I'm always on the lookout for that, and always hopeful that those things come to our attention so that we can make sure that the patient experience and the staff experiences is what we tell them is going to be when we do their orientation. There was just orientation this morning, so hopefully those are the things that happen. So my fear is always, you can't know everything, but you don't want to find out about it in a negative impact on somebody.
All right, thank you, Gail, and thank you, Dr. Grover. Now, our next panelist is Sharon Sheard, and Sharon is the manager of our regional renal program. And Sharon, I'm going to turn it over to you for your questions now. No, we can't hear you, okay. Sharon.
I'm there. Sorry, technical difficulties. Hi, Gail. Welcome. RVH is truly a great place to be. What is your philosophy about local health care?
My philosophy about local health care, I think that, you know, I have spent the majority of my life in Northern Ontario. In Barrie, I don't consider Northern Ontario from where I used to live, originally from Sudbury, and then spending 25 years up in the far north. You know, it's all about local, what you can get local. When you live in the north and you see families have to travel to Southern Ontario, travel to Toronto for healthcare, or simply not receive healthcare because they don't have the means to do that. They don't have the means to take however many days off work, or they travel for a day or more to spend 15 minutes in a patient consult with a specialist. You really see the impact that has on families and patients. So I think for me, local healthcare means within a reasonable expectations that patients should have healthcare locally. And that just, also means local within our region. When we get into our specialized services, there's some things that our partner hospitals in this Simcoe County are not large enough to be able to do, but people shouldn't have to travel to the GTA for certain things, and we should be able to support those services to be offered locally. Patients shouldn't have to travel down to Toronto or anything else for things that we're already doing here, or that we could easily do here. So local really means that, advocacy to make sure that the patients get the services they need as close to home as possible, as the expectation is in the rest of the province.
Thank you. The next one is, what drew you to healthcare?
I think initially the complexity, I saw a lot of problems. I love solving problems. I like challenges, and seeing that and the ability to make such an impact. And you're working with individuals, when you're in healthcare, you're working with individuals who actually care about their shared purpose and passion. You don't always get that in the private sector. A lot of times private sector is completely about the bottom line and making money. And I think that nothing really pulls people together other than this shared passion about healthcare. And, there's a little bit, sometimes it's hard to deal with the bureaucracy that comes in healthcare, but the passion of the people working together really helps you deal with that and get through it. So I think that's really what drew me. It's the complexity, having a positive impact on people's lives that you really can't get anywhere else.
And what is the best thing about healthcare?
The best thing about healthcare, I think, is when you get those patient stories about what a positive impact you had on their lives at sometimes their worst moments. It really reminds you what you're here for, especially if you've had a bad day. I think it's important as leaders, that we always share those stories with the front lines, so they can hear what an impact they're having. So even when you get a negative experience back and when you're able to solve the problem and bring that back to that patient, to say how them taking the time to tell you about their experiences really, helped patients in the future not experience that as well. So I think those moments are really the best thing about the industry.
What do you like to do in your downtime, and why is downtime important to you?
I think it's important for everybody, especially in healthcare. I mean, we have a lot of exhausted people. I like to do a lot of mindless activities that don't require decision making. Although I said I'm decisive. If you ask me later on about what restaurant I want to go to supper at, I don't want to make that decision anymore because I'm worn out. Save the superpower for work. But I like to do quiet activities, probably things that are going to help me reboot. So hiking with the dogs, yoga, jiu-jitsu, podcasts, listening to that, or just reading, things you can do by yourself, things that are relaxing. So that helps me recharge and get back to having the adequate energy levels to come to work.
Thanks, Gail. So, a blue belt in jiu-jitsu and someone who likes to debate. So I think we maybe want to be cautious about that. What do you call it? Rolling with it?
That's
rolling?
Right. Yeah.
Okay. Don't want to be doing any of that. Okay, thanks, Sharon. So Gail is really known for building these really strong teams and seeking out diverse opinions. And she values different experiences, ideas, perceptions, as you've heard. She wants to hear from every member of Team RVH. So whether you're a nurse, EVS worker, administrative assistant, physician, or a leader, Gail wants to hear from you. And our next panelist is Faye Turner, a longtime EVS logistics attendant. And Faye, do you have a couple of questions for Gail?
Hello, Gail, and welcome to RVH. First of all, I'd like to say how lucky I've been to work at RVH for so long. What makes a good hospital exceptional, in your opinion?
In my opinion, what makes it exceptional is the people, and really, you know, what gives the opportunity for exceptional people to gather is really if your leadership is valuing you and supporting you, that makes you want to come to work every day and makes this an exciting place to work. So my job is really to serve the staff that work here and serve the medical staff and the volunteers that come here to make sure that the exceptional people want to stay here and want to grow with RVH. So if without the right people, this, you know, the things we want to do and the patient experience just won't be there. So that's the most important thing.
Now, on a little bit of a lighter note, what is your favorite book and your favorite movie, and why?
So I do read a lot of nonfiction, but I would, you know, just because I have a thirst for knowledge and learning, but along with my mindless activities that I referred to below, I will also do that with fiction books. So I did read all during COVID, I read all the Outlander series. I read all the American Assassin books and Brad Thor books. So I really like CIA and spy and things like that. And Bridges of Madison County was one of my favorite movies, and It's Complicated. Both contain Meryl Streep, who I think is an awesome actress. And of course, I think I did get addicted to, you know, mindless shows like Below Deck during COVID, which is regrettable, but it happened. So yeah.
So other than yoga, what relaxes and recharges you?
I think a day of solitude. You know, I commented that I'm not a successful empty nester yet. I haven't been able to boot the last one out of the house, but so there are opportunities every so often where I get the house to myself, and there's nothing like a weekend or a day with nobody else around. It really lets you relax and recharge, and not doing anything in particular, but doing anything you want. So that's really my dream day.
Thanks, Gail. And thanks, Faye. I think we're all struggling with the empty nest syndrome when our kids all came home during the pandemic, but it'll happen and then we'll miss them terribly. So thanks again, Faye. Our last panelist today is Sherry Francis, and Sherry is a registered nurse on our very busy transitional care unit. Welcome, Sherry, and I'll turn it over to you.
Hi, thanks for the introduction. Welcome, Gail. So my first question is, what is your message to Team RVH?
My message is I'm very excited to meet all of you. Please be ready to speak to me when you see me and tell me what thoughts you have about RVH, about what could be better, what is great. I want to hear all those things, and I think hearing from you is what's going to help leadership drive the organization to be even more exceptional than it is. And so without your feedback, we really don't, you know, leadership can't know what needs to be done if we don't get that candid, honest feedback from all of you. So my message is be ready to share, and I'll listen to whatever you have to say. It doesn't have to be all nice, and there's no repercussions for sharing. So that would be my message.
Love that. And I'm sure you have lots, but what is it that you're most proud of?
What am I most proud of? God, that's hard to. I think I'm most proud of my. I'm most proud of my kids. You know, they turn out to be kind people, is all we all hope for. Even though maybe at home they save the best, the worst for us. But when you get back from other people, what responsible individuals they turn out to be, I think that's the most proud moment. Even prouder when they move out and they get off the payroll. That's probably even better, but those are proud moments for me.
Yeah, we have 3 young ones, so I can't wait for those days. Okay, and so my last question is, what was your first job and how do you think it prepared you to be RVH's CEO?
Sure. So back when I was 14, I grew up in Sudbury. My first job was at McDonald's. My mother pulled up to the parking lot and refused to leave until I went inside and got an application. Back in those days, you fill out a written application at the counter. So my first job was working the cash at McDonald's. And I'd say, how would it prepare? Because one thing about McDonald's is when I started, I think there was 4 binders of standard operating procedures that you had to read and memorize, down to how you speak to the customer, add-on sales. everything, quality control, French fries got to be thrown out after 7 minutes, all those things. So you'd be surprised how much quality control and standard operating procedures you would learn operating at McDonald's. So that really prepared me for healthcare, I think.
That's awesome. Thanks, Gail, and thanks, Sherry, as well. Nice to see you. Yeah, I think that anyone who had their first job in food service remembers the fast-paced customer focus and very demanding, or sure felt like that. Mine was at Dairy Queen, and that comes along with that job. So all those skills and herding the cats are not lost in healthcare, that's for sure. So thank you to all of our panelists for taking time out of your busy schedule and joining us today. And since Gail has been on the firing line, I think it's only fair, Gail, that we give you a chance for any last thoughts or messages to Team RVH. I'll turn it over to you.
Thanks, Suzanne. I think I just want to thank everybody. I know you've had the same leader for 18 years, so it's always a little nerve-wracking to get somebody new and think, I don't know how she wants things done. I don't know how they want decisions made. So, you are the experts at what you do, and I trust in you to do your jobs to your best abilities. And I think you should, start, if mistakes are made, we'll revisit those and we'll talk about how we could have done it differently. But really, this is about, I'm here as your leader to support you. You're the experts in what you do, and I trust in you to do that. So I'm excited to work with you and get to know you all and see where we go from here.
All right. Well, thank you, Gail. Thanks for being such a good sport, letting us ask some non-standard questions today. RVH and the community that we serve, we're both very excited to have you at the helm of our health center, so welcome. This was our opportunity to get to know Gail, but over the coming weeks, she will embark on a listening tour where she'll visit all the different departments and spend some time getting to know you and the important work that you do. So if you see her in the hallway in the next little bit, do stop and say hi. I know she'd like that. And I hope everyone has a chance to get some well-deserved time off during the summer. Hope you can rest and recharge. It's been a pretty tough year. It's been a tough couple of years. Hopefully you'll be able to get some time off with your friends and your family. So thank you again for joining RVH's virtual town hall today. Stay safe, stay healthy. Until next time, we hope to see you soon. Thanks, everybody. Have a good day.